Good morning, everyone. It is about 6:15. I'm about to head to work. My commute is very short. It's like 10-15 minutes, and it's freezing outside. The sun hasn't come up yet. Hopefully at work today I get a labor. Last time I had postpartum, and for those of you who have followed me might have noticed that labor is more of my passion than postpartum. So come on and join me. We still wear masks to work. I know some hospitals don't. And today I'm wearing one of my favorite scrub caps with the pregnant emojis. And I'm wearing my favorite necklaces today. They just make me happy. I always have a fanny pack with me to carry the extra things that I don't want to put in my pockets. And I always bring goggles with me. These are stoggles. I wear them during every shift, especially during a delivery because birth can get pretty messy sometimes. And I'll show you what I keep in my fanny pack. I have scissors, chapstick, hair ties. I have a little case for pens, and I always bring a clipboard with me. I love this one. It is foldable and it is more compact, and also you can hide patient information by folding it up. Here is my report sheet. This is good for labor and postpartum. Having a report sheet is key to keep organized, especially for postpartum. A link to this report sheet is on my website. You'll find it at the very bottom. Before I get report, I always fill up my water jug. It's often hard to stay hydrated during a full 12-hour shift because we're so busy, and it would definitely not happen if I didn't have my water jug filled in front of me. So I at least try. So today I got report on a mom who was being induced. She was here throughout the night getting a couple pills to try to soften her cervix and potentially have her go into labor, but she did not go into labor yet. So I'm gonna have to call the doctor to figure out the plan of care for this patient, and then I'll go to the patient's room to educate her on the plan of care and make sure that we are on the same page and she agrees with the plan of care. I'll educate her about the process and answer any questions she may have. But before the process starts, I make sure that she has essentials like water, food, figure out what type of pain management she might potentially want. This patient didn't have a hair tie, she needed one. I got one and I braided her hair. The plan was to start Pitocin on this patient, but before starting Pitocin, we do have to monitor the mother before and during the process. This machine is called a Novi. It is a wireless monitor, so moms are able to get up and be more free during the induction process when they have to be monitored for a continuous amount of time. A patch will be placed on the mother's belly, and it looks like this. We do have to wash their bellies first, just in case there's any lotions or any oils that may interfere with the patch being stuck on the skin. I do it when she's just sitting in bed. I use baby shampoo and wash rags to wash her belly off. Before placing the patch on, we do use this paper. It's like a little sandpaper, and you have to use it on the areas where the pads will stick onto the skin. So once the patch is on, this is the little device that we put on the mom's belly. They have to stay in bed for about 20 minutes for the monitor to read, and then they can get up. And when it works great, and I love it. When using Pitocin, we have to label our lines. It is considered a high-risk medication, and 2 nurses have to verify that the Pitocin is being hung and it is the correct medication and correct dosage. It's typically started on a very low dose, and we will increase it if needed. And before the medication is started, we typically do have to check the patient's cervix just to make sure that it is favorable. Vital signs will be taken on the patient, so temperature, blood pressure. We also like to get a pulse ox on the patient, and this will also be done throughout the induction process. The frequency just depends on what's going on with the patient and hospital policy. And like I said, we do a cervical exam before the induction process is started. Sterile gloves are used, and I always use lubrication. This patient made a good amount of change just within an hour of being on Pitocin, so I started antibiotics on her because of her GBS status. And after I got her antibiotics set up, I started to prepare the room for delivery because at my hospital, we do not have perinatal techs. The nurses do everything. So I do a lot of multitasking. A delivery table needs to be set up. There are the tools, and this is a packet with the rest of the stuff that needs to be on the table. This is what a delivery table looks like typically for a vaginal delivery. There are instruments on it to clamp the cord, cut the cord, any potential repairs the mother may need, a gown for the provider, a bucket to catch the placenta, and a bucket to put warm water in. And we always have the baby warmer prepared. This is very important to have and have it prepared in the room. This is just in case an emergency happens and the baby does need resuscitation for one reason or another. I always make sure that all the equipment is functioning before a delivery.
I also make sure that the air and oxygen tanks are at an appropriate level. If a baby comes out crying and screaming and does not need any resuscitative measures, the baby will stay on mom. Another part of this machine I check is the suction. So I make sure everything is at the appropriate pressure and suction level. Sometimes suctioning is required for a newborn when they come out in distress. And when you hit this button right here, the warmer will come on. So there are different levels of warmth you can choose from. So there is 0% warmth to 100, and it does get pretty warm. And there's a button right here that you hit to start the APGAR timer. So we do APGARs at 1 minute, 5 minutes, and potentially 10 minutes if the baby needed resuscitation or we were concerned. And this is a peanut ball. For anyone who's gone through childbirth, you might have used this, and studies have shown that this has helped progress women with their labor, especially moms who are stuck in bed. This patient was interested in having a mirror to help her push, so I got that out to be prepared. When someone is able to see themselves push and make progress, it does really help them. With the peanut ball being used and the patient being able to get up out of bed and move her body, she made great progress. She got to 10 centimeters pretty quickly and had to push, and it was actually a great, quick, beautiful delivery. And we were all prepared for it. Her baby came out screaming, which is music to my ears, so the baby did not have to go to the warmer. It stayed on mom's chest while she was doing skin to skin. I did the baby's assessments. When I'm assessing a baby on a mother skin to skin, of course, I look at the baby's color, I check the baby's heart rate, respiratory rate, and we take the baby's temperature. And again, this can be done right on mom's chest when she's skin to skin or breastfeeding the baby. And the mother's vital signs also have to be monitored, and we have to check the patient's bleeding as well. It's very important to make sure that she's not bleeding too much. If she was bleeding too much, interventions would definitely have to be done. Once I made sure that the baby and mom are stabilized, I go and get her some food. And of course, I made her a mama mocktail. I asked her what she wanted specifically. I gave her options, and she just wanted a Shasta twist, lemon lime, and cranberry. These drinks always hit the spot, especially after you give birth, and patients always appreciate it. And I'm also making an ice pack for this mom for her lady parts down there. This is how I make an ice pack. I use a diaper. You cut the top and then essentially just fill it up with ice. It's a little bit of a process, but they work great. Once the diaper is full, this is how you close the end. It was like it was meant to be an ice pack, I swear. Some patients love ice packs, some don't. After I get the mom all comfortable, I check her bleeding again, and then I go take a snack myself. This is what I brought for lunch. Having a break is definitely needed. It recharges me for the rest of my shift and to take care of my patients properly. So we keep mom in bed for at least an hour, if not two, to do skin to skin with baby and make sure that her vital signs and bleeding are stabilized. While she is doing that, I get the bathroom all set up for her to take a shower, because a shower after birth is life-giving as well. I make sure that she has all the essentials, so underwear, a pad, towels, stuff that is needed to clean her body. Patients can wear their own clothes at my facility if they want. Whatever makes them comfortable, I completely support. And now the mom is ready to get the weights and measurements on baby, which is my favorite part. The head, chest, abdomen, and of course the length is measured. I also take the baby's footprints. This is a pad that doesn't get ink on the baby's foot. It's pretty awesome. As you see here, I put my finger on the ink pad and my finger is not stained with ink. After the baby's footprints are taken, I take baby powder and put it on top of the ink, and that sets it. Otherwise, it will smear. I let parents take the ink pad home with them just in case they have a baby book. And these are the newborn baby meds that we give all babies at the hospital unless a parent declines. I'm not going to get into it because that in itself can be a video on its own. I orient parents to this futuristic looking crib. It's actually really awesome. It can just roll under the mother's bed so the baby can be right at the mom's foot, so they don't have to get up to get the baby. A security tag is put on every baby's umbilical cord. No code pink on my watch, please. Oh, and if you're interested in being a labor and delivery nurse, let me tell you, there is a lot of charting on a fetal monitoring strip. And charting is a big part of the job. If you didn't chart it, it didn't happen. So you really have to find the good balance of being there for your patient, but also keeping up with your charting, because if not, then you're gonna stay over and be really far behind on charting. This patient had a beautiful birth and great recovery, pretty much an ideal day. And I also scored an extra patient tray before I went home. For those of you who have been following me for a while now might know that I really like hospital food. And this might actually be my favorite meal at the hospital. And this lemon bar, delicious, best lemon bar in town. I got all my charting done. Now I'm heading home to see my own family. Thanks for following me. I hope you got inspired or learned something. If you like this video, please subscribe and I'll continue to try to make more of them.